Hi, my name is Amy, and I am one of the acupuncture and integrative medicine doctors at Nurturing Touch Massage and Acupuncture. And one of the services that both myself and our other doctor of acupuncture, Judy, offer are to help patients get down to the root cause of where their symptoms are coming from. There's frequently patients that we're seeing who are frustrated because either their Western medicine physicians are not running the labs that they would like them to run, or they are running the labs and being told that everything is normal and within range when these patients are still having symptoms. That's one of the most common things that we're seeing. And so what Judy and I will do is we will sit down with patients and go over their health history, the symptoms that are bothering them. That cues us into what types of labs should we run. Are we running serum or blood labs? Are we running a saliva cortisol test? Do we want to test for heavy metals or mold? Do we want to test for allergies or sensitivities to food? So there's an array of different tests that we can run for patients, and our goal is to help navigate what types of tests need to be run, order those tests, and then once those tests come back in, we can create a treatment plan for patients that lets them know what they can be doing with diet, supplements, herbs, acupuncture, the whole bit, to be able to help them get back to feeling themselves. And so for an example, one of the common things that we see are patients sometimes have even come in with lab results that they've already had done at their Western physician's office. So an example would be a patient who has issues with thyroid. That patient could be coming in and seeing their provider, and their provider is letting them know that the labs are within normal range. This patient may even have a trend of those labs getting worse and worse over time, but because those labs are still technically within inside the limits of what Western medicine would say is where the disease would be, then there's nothing that the doctor can do because there's no diagnosis. But frequently those ranges are so broad that patients are extremely symptomatic even within what Western medicine classifies as a normal range. So being able to see an integrative medicine provider so that we can offer support and help through for that patient, even through those low end or high end labs that are not technically outside of Western range of normal yet. That's a common type of patient that we see. The other type of patient we see are patients who are coming in and they're frustrated because they feel dismissed by their Western doctors because they have asked their doctors to run tests. Their doctors have run minimal testing and said that everything's perfectly fine. One example of how this is commonly misconstrued is with a thyroid panel. So a thyroid panel is going to consist of a lot more than just TSH, which is thyroid stimulating hormone. It's also going to consist of more than TSH plus T3 and T4, and commonly those two options, either just TSH alone or TSH along with T3 and T4, are the most common ways for Western physicians to run what they're considering a thyroid panel. Unfortunately, this is not a complete thyroid panel. They're also missing out on TPO. They're missing out on the reverse T3 is a huge one. So reverse T3, for example, is an isomer of the T3. So your T3 is your circulating thyroid hormone, and that is the usable thyroid hormone in your body. A lot of times people can have a T3 number that is perfectly normal, and even T3, T4, and TSH can all be normal. If you have a high reverse T3 though, that reverse T3 is going to sit in the receptor sites for T3 and not allow you to use that active thyroid hormone. So if your reverse T3 is not being measured, then we don't really know if you can even use all of your T3 that you have, even if you were to have adequate levels. And in a patient like this that has a normal TSH, T3, and T4, if they have high reverse T3, they're going to show signs of hypothyroidism or low functioning thyroid because they aren't able to really utilize their thyroid. If their doctor has not ordered a thyroid test for reverse T3, then their doctor could be telling them that their labs are perfectly normal and that there's nothing wrong with their thyroid, and this patient leaves feeling frustrated and questioning themselves and knowing that it's not all in their head, knowing that they have symptoms, and then trying to find some other route when it could be that it really is an issue with the thyroid. It's just reverse T3 was one of the labs that was not run. So this is just an example of how seeing somebody who's looking at it from an integrative medicine perspective can be really helpful, because you want someone who knows what labs to run and to do a full and complete panel so that we can really accurately assess if there's something going on before moving on to other tests. And that's just, again, thyroid as one small piece of a wide selection of labs that we can run to help people be able to figure out what's really going on so that they can get back to feeling their best.